Greetings and welcome to the weekly educational rounds here at Sinclair. My name is Jim Ellermeyer, and I'm a behavioral health therapist here at Sinclair. And today I'm joined by two of my colleagues. On my right would be...
Hi, my name's Sasha. I'm the physician assistant here at Sinclair.
And on my left?
Chaudhary. I'm a psychiatrist here working for Jim.
Good. It's always glad to have people people under me and people who know their place. So the idea is here that at Sinclair, which is a holistic integrative psychiatric facility, where we attempt to look at a mind, body, and spirit of an individual, where we don't try to label people. What I'd like to do is begin by asking Dr. Chaudhary what his original vision was for Sinclair whenever he saw this property.
Well, we were talking about this sinkhole on 22, and maybe we'll start with the sinkholes of our life. So I was working through my sinkholes in my life as well, which were the difficulties associated with the career path, the difficulties associated with the medical healthcare systems. And so I recognized that we as a healthcare system are very much driven by the nature of symptoms when they are very severe, and we fix them. And I'm working for an HMO as a medical director, actually more than one. I realized that how much of money goes in healthcare system to fixing problems when they are severe and serious, and how little we pay attention to things when they are beginning to be a problem, recognizing them, educating, and being able to divert from a simple thing to become a disaster. So with that said, none of the places where I worked at would support the idea of me becoming a doctor and an educator, because I should be a production factory. And a production factory means the more people you see, the better doctor you are. So this really became a place where we had to make decision, at least I had to make a decision in my life, what I'm going to be doing about my personal travels, with or without knowing how to do a business of life. And so that became the inception of this idea of working towards the goal of having a holistic treatment offering, science-based, strong and long-term propositions, and yet cheaper alternatives, or I would say inexpensive alternatives to healthcare, I would say a disaster.
So what I hear you talking to me, Dr. Chaudhary, is about allowing people to be more proactive with their health and wellness rather than be reactive.
Absolutely. This morning was a perfect example. I have somebody who has a severe bipolar disorder. He owned his own construction company. As his condition worsened, his ability to continue to function in that role continued to deteriorate. I remember seeing him as an emergency, and his exposure to mental health care was very traumatizing. He had been handcuffed, taken to a hospital, and felt he had no say in his treatment. We feel very strongly that people have a lot of say in their treatment. Today, he is very knowledgeable about his condition. He reminded me that at one time I asked him to see if he could be on disability, and he said, I'd rather be walking on my own 2 feet than be disabled and not being able to function. So he is learning, he has understood the condition, he takes medicines appropriately, but he also do meditations and pays attention to his health care, which is his own medical conditions.
And what you're talking about is the person-centered philosophy of Sinclair, where we firmly believe that a patient has a vast capacity for understanding themselves and resolving their own issues with some assistance.
Well, they are the key driver. We are consultants to people's needs. We are not the drivers of their cars. They must take responsibility of their own conditions, own up to their own challenges, and then learn how to manage their own conditions effectively.
Absolutely, absolutely. As myself, I was a student here at Sinclair, and still here. And as you, Sasha, you were a student here at Sinclair. So tell me some of your thoughts about wanting to become involved with us here.
Well, I'm a physician assistant, so I was in PA school, and this was actually only my second rotation in my studies. And I came here, I was always interested in psychiatry, but everybody actually said to me, oh, that isn't what you want to do. You know, you won't be involved with your patients. You'll just give out prescriptions. And I thought, well, you know, I'll just see how it goes. And I came here and it was like just totally meant to be. You know, that is the opposite of what we do here. Medications are just a support system to help people get through troubling times, and the real treatment kind of comes with discussion, with the DBT skills that we implement, and we really do spend so much time with our patients and help them get over issues in their lives, and I'm so proud to be a part of this.
And so could you share with us some of the things that attracted you to becoming a full-time staff member here, some of the things that Seclair offers and some of the things that we do that perhaps may not yet be integrated into other facilities?
Sure, and you know, there is something to say for having a lot of options for patients. You know, we talk about adjunctive therapies, and while they aren't always good for everybody, the fact that they are available to the people that can really benefit from them is really special. And one of my special interests throughout my life has been horses. You know, I'm an avid equestrian, and like I said, I always did have an interest in psychiatry, and I feel like incorporating horses to help people kind of find a place in their life is really a cool idea, and Dr. Chaudhary is actually really supportive of that idea, and we're looking to sometime in the near future get a kind of equine-assisted therapy program up and running to help people that are interested in that kind of adjunctive treatment option.
And what we do here at Seclair is offer people enhancements to their recovery, enhancements to their life, and enhancements to their wellness. Could you talk a little bit, Dr. Chaudhary, about the way that we avoid putting people into boxes and labels here at Seclair?
Yeah, I want to kind of pick up on horses for a moment. So I was making rounds at the hospital, and half of the people I saw had lost their driving license because of a DUI. So I gave them an advice of getting a horse. I think that a horse does not require a license, does it?
No, it doesn't.
So a lot of our people will be coming in riding horses because we see people who have DUIs and they have a family member bringing them here. Kidding aside, it is finding our way in life in spite of our difficulties. If a car is not working, then I got to figure out how else to be able to work around my challenges. And so I just want to kind of highlight that sometimes people think that we are just doing yoga here. We do much more than yoga, and yoga is part of our mindfulness practice. So I just want to kind of highlight, we bring in some of the best pharmacological treatments in the country to people's treatment. So this is, as an example, Mass General Hospital Psychopharmacology Update. So this book has the latest information about the current diagnostic issues, bipolar disorder, mood disorders, issues surrounding the nature of our many illnesses. You have to be a good diagnostician to be able to be a good clinician. So we pride in the fact that we take time to make good diagnoses, then find the best treatments at a national level to afford to people's care. And with that, we dive into the fact that people need to live healthfully. That means the simplest things, such as if they're eating junk, their body cannot take advantage of these medicines. They ought to be able to have, making sure that they're not drinking pop. I just saw a woman yesterday, she from another state, but was admitted in the local hospital, and she drinks Coke like you can never imagine. And that creates so much of difficulty in the acid-base balance in body's metabolism. So we teach people how to live healthfully through nutritional health and well-being. And last but not least, I'm becoming an avid recommender of letting people know that old sciences are very good sciences. So there's the whole psychiatric annals about MAO inhibitors. These are medicines which are treated for depression, and this is one of the most likely, for me, a journal that brings in information about. We sometimes, when we embrace new knowledges, we forget that oldies can be goodies. And with that said, my last thing is people must have a spirituality. Without spirituality, they cannot live on this earth. because we live in a very broad universe, and our medicines cannot hold people's agonies. Simple. So I'm very bold in letting people know, find a way to contemplate, or you will waste away. Contemplation is very important science that rarely is allowed given our present day rat race.
And given that, quite often I'll ask people to reset their internal time clocks to Buddhist Standard Time, which is the present moment. And Sasha, you know I'm fond of asking people what time it is.
The time is right now.
And the time is right now, and it's always right now. And staying in this moment, I'd like to have Dr. Chaudhary and Sasha give a brief overview of their vision and intention for Seclair, which is greatly different than a resolution. You and I just did a group on intentions.
Yes, we did.
So I'd like to hear that from Dr. Chaudhary first.
We set the intention that every human being who lives on this earth is uniquely gifted, uniquely beautiful, and that if they come into a treatment for a reason, whether it's a mood disorder or a trauma or a hurt or an addiction, that their nobility is superb, that we as staff would like to be part of their life's journey, not seeing that they're broken, but they're very whole, that they're very holy, that we are part of that they're giving us the privilege to help them. The tools of help are meditational practices, medicines, nutritional health, supplements when they're needed, and also all the alternatives that can support their needs. But they make the decision, we provide them with the opportunity. And as long as we can do it, we will continue to do that.
Sasha?
And I think that, Dr. Chaudhary has always put that very beautifully. I always say, I really appreciate what the patient brings to the table because, they're trusting us to help them through a lot of difficulties in their lives. And it's really is a privilege to see that. And, we see so many different people coming from so many different walks of life for so many different reasons. And it's really cool that our practice has been able to incorporate, helping all those different people from all those different backgrounds. What we really do really actually works, for so many different aspects, because it is all about, making sure that you're healthy and you're whole and you're taking care of yourself. And, we don't neglect medication, scientific proven methods, but we incorporate all these other options as well, and I'm so proud of that, and I think we'll continue to do that.
Well, one of the things here at Seclair that I'm so fond of is that we see individuals as strengths, talents, and abilities that perhaps with some encouragement and support and some assistance can develop those strengths, talents, and abilities to deal with the speed bumps in the potholes and the sinkholes on 22 that happen in your life. And again, we offer you a free prescription for today. I'm not a prescriber, so I can't give a prescription. I can give a free one though. Fruits, nuts, and vegetables, perhaps unplug your television, and take out fishing. And as my friend Sven and I often do, for a real mindful experience, we fish without bait. And I'll ask my colleague and my friend Sasha to
do the closing. So to continue this conversation, please like us on Facebook, plus us on Google+, or follow us on Twitter under Seclair Life. And keep an eye on any of these for our next live recording Mondays around noon to ask your own questions. You can also find this and other grand rounds on youtube.com/Seclair video and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. And please visit Seclair.com for more about us and other articles in our great blog. We'll see you next time.
And until we meet again, would like you to commit to being good to yourself. And thank you.
Thank you.
Thanks.